Went to undergraduate at Northwestern University up in Evanston, Illinois, just first suburb north of Chicago. Went to medical school at Medical College of Ohio, which is now affiliated with the University of Toledo, closer to my home. Met my wife during medical school in Chicago. She was working up there, and pretty early on in our relationship, she had mentioned that she was moving back to St. Louis, and so I was able to match at WashU in St. Louis here for residency, and did my 4 years in emergency medicine residency down here. My mom was a nurse's aide in an emergency department, so I was always kind of in an emergency room, so enjoyed learning about that and spending time with my mom, so that she kind of exposed me to that lifestyle. I actually went to college as an engineer, and did the co-op program, worked for a small engineering firm back in my hometown as well, to help pay for college, and actually had my Bachelor of Science in Civil Engineering. As I got farther along in engineering, I really wanted to get back to being with people, talking with people, and that emergency department setting has always been a drawing for me. So I've always wanted to do that. So that was the major impetus to get away from engineering, and I couldn't be confined in that little cubicle any longer. At St. Peter's, and obviously here at Progress West as well, I think kind of a unique situation to have two sister hospitals here in St. Charles County to provide the needs for this area. The nice thing as well is that you always have the affiliation with BJH downtown, which is, obviously a huge hospital, and that capability to have that as for subspecialty care if it's needed. Our subspecialists that work with us out here are spectacular, but if there's something that open heart, or something that would require further care that just isn't offered out in the St. Charles County here, to have that affiliation is spectacular. The biggest misperception of emergency medicine is that the ability to accurately diagnose everything at that time, and I think that's the hardest part about being an emergency physician, is that we may not know what's wrong with you, but we've made sure that you don't have something bad going on. But as a patient, you have to also be comfortable with the fact that if the physician sees you and is able to let you go home, they've ruled out the bad things, or through their medical training and experience. I couldn't do it without my wife. She does everything for us as a family. I do what I do so I can spend as much time as I can with my family. So I think that's the key thing, is that I want to be able to be there for their swim meets, to go outside and pitch baseball to my youngest son, or go to a dance recital. That balance is required, I think, for a healthy physician, is to know what's important to you. And my family is the most important thing.